Next, in reference to your leg length discrepancy that's occurring on the same side as that SI posterior rotation, here we have a diagram of the knee joint itself as it associates with the muscles of the thigh and also the lower leg. Let me lower this down just a smidgen. There we go. All right, here is your patella. Now, just speaking with you over the phone, I feel as if your issue is going to lie in your patella and not in some of the other areas that I will mention in a few minutes. When one leg is longer than the other, you have to understand that this thigh is going to internally rotate. It's going to turn. It's going to turn in slightly. This knee, the lower leg is going to turn out, and then following that, the foot is going to become flat. That is a response to that leg being longer. Something has to happen so you can still walk and clear that foot from the ground. So that is what I'm saying is happening. When those three things occur, then this kneecap is actually going to be positioned a little more lateral than normal. That's going to come into play when we talk about your knee exercises, okay? So pay attention to that. The kneecap is going to be pulled a little more lateral. We call that lateral patellar tracking. A lot of times that's due to muscular imbalances. But for you, I really feel like it's due to the issues in your hip and the weakness creating that long leg length discrepancy. Because when you corrected it, then that patella should have returned to its normal position, and you should still have a little bit of pain because it's injured, but at the same time not have that same sharp stabbing pain as if you were directly facilitating that pathology. So that is the basis of what I feel is going on with you. I think you have some lateral patellar tracking. Because of that lateral patellar tracking, I feel because of your lateral patellar tracking, I feel like the medial surface of your patella has become irritated because it is going to basically move out of position when you're in that situation. Here's a picture of your knee without the patella. That groove here is where your kneecap should be. Your kneecap is more positioned here to the side. Therefore, you're going to get a lot of shearing on the medial surface of your kneecap. The other things that could be going on, if you see here, that's your meniscus. That's the cartilage in between your knee. I don't think you have any kind of ACL or PCL issues at all. I don't think that's the case at all. I think that your issue has to lie within your patella, and at the very worst, you may have a little meniscus derangement, issues in your meniscus from overcompression. Here's a picture of a pinched meniscus. Here's your meniscus, or here's a better picture of your meniscus, and right there you can have a pinched meniscus here because of the position of your knee. Either way, I think we're going to be able to fix this problem. So hold tight 1 second and we'll move on to the next activity.